Respected seniors and my dear friends, I, Dr. Meenakshi, working as an assistant professor of ophthalmology at CHACHA NEHRU CHIKITSALYA, am going to present my work on development of an age-appropriate visual function questionnaire in a community-based childhood visual impairment study. Thanks to BMJ International Quality Forum for giving me this wonderful opportunity to present my PhD thesis work conducted at Dr. Rajendra Prasad Center for Ophthalmic Sciences, AIIMS in India. So what is Visual Function Questionnaire? VFQ. It consists of two parts, visual acuity and functional vision. Visual acuity is a clinical measure of an individual's ability to perform specific visual tasks, and functional vision is a vision which is used in performing daily routine outdoor-indoor activities. There are a number of instruments for assessing visual function related quality of life in children, but these are unable to do a detailed assessment of the impact on the children living with visual impairment. Different VFQs available in visually impaired children are CVAQ, IVIC, LVP VFQ and CVFQ. All of these have been asked from the children who were visually impaired or normal to determine the visual related quality of life, except for CVFQ, in which the parents were asked visual quality of life. So the purpose of the study was to determine the visual impairment prevalence in children. Along with it, we did in our PhD study, we did an important task of formation of an age appropriate visual function questionnaire. Analyze the suitability of existing visual function questionnaires, which the most commonly used were IND VFQ 33, which was designed for adults, and LVP 20. This IND VFQ 33 consists of three domains: general functioning, for psychosocial, visual symptoms, and LVPI consists of domains related to distance, near vision, and psychosocial items. All of them have been graded on Likert scale. For IND VFQ it is for between 0 to 4, and for LVPI it is 0 to 3. Greater score meant higher disability. So the methodology consisted of 4 steps. In the first steps, the experts were asked to give their opinion. And who were these experts? They were the people, professionals belonging to public health, low vision and ophthalmology at RP Center AIIMS. A workshop was conducted. A consensus statement on age appropriate visual VFQ tool was derived. The main thing which they did was they removed the questions which were found unsuitable on the basis of difficulty in comprehending the language, or the questions which were duplicate, and out of those questions which have similar language or were duplicate, the question with easy inference. So in this way, out of the total 53 questions, they finally reached at step 2. There was detection of zero variance. Zero variance meant that if the questions were checked for their responses by giving them to the children who were visually impaired, these were the children who were referred to the central clinic from the field with the unaided vision less than 6/12. It was decided by experts that they will be divided. The questionnaire would be asked in the younger age group from the parents between 5 to 9 years. The questionnaire would be asked from the parents, and in the 10 to 15 years it would be asked from the children itself. So after checking for zero variance, it was found that in the lesser age group 5 to 9 years, 3 questions were the ones which had zero variance, that is, most of their responses were clustered around one of the options, wherein the higher age group analysis. So in factor analysis, it involved calculation of factor loadings and rechecking of zero variance, and only the loadings having the values more than or equal to 0.59 were retained and were subject, which meant determination of Cronbach's alpha. Cronbach's alpha ensures minimum variability between the items, and it checks for the internal validity. The Cronbach's alpha of more than 0 is considered as significant. So on calculating the Cronbach's alpha in both the age groups, it was found that in the younger age group, 2 domains were the ones in which the Cronbach's alpha was less than 0.6 and the overall was 0.839, whereas in the higher age group, all the domains had their individual Cronbach's alpha of more than 0.6 and overall alpha was 0.924. So when this VFQ was subjected to the children after giving them surgery and providing them with the glass, after doing their surgeries like squint or cataract and providing them with the glasses, there was a significant change in the visual function quality which was less than 0.005. Thank you.